Who's responsible for this?
She is.
Oh, yeah, we talked about how you don't want to get on the nurse's bad side.
Nope. What's going on, everybody? Welcome back to the channel as we take on another episode of Scrubs, episode 2.
The Scrubs.
Only Scrubs tonight. I'm Dr. Todd, by the way.
I'm Allycia.
We want to thank you all for being here. We had such an awesome experience with episode 1. You all were fantastic. All the comments, keep it coming, because we can't wait to get into more of this, see what's going on with JD and company as we advance through residency training. We'll see if this is like day 2 or like month 2 or whatever. We'll see how much time's elapsed.
You really resonate with JD, don't you?
Without question, yeah.
Why
I mean,
is that?
Well,
You didn't say what kind of doctor you were or anything.
I am internal medicine.
There you go.
Yeah.
What if they don't know? What's their first time coming here?
I'm an internal medicine doctor. We'll put a little.
I am not medically trained
Yet. She's going to the school of Dr. Todd, though. Anyway, that sounded better in my mind. We're going to jump into this. Calm down now. You ready?
Calm down.
You ready?
Just good, yes.
All right. Play. Subscribe.
Once a day for 9 years, I thought that I lost my watch because I can't remember which wrist it's on. And yet, just after 2 weeks, all
That's something you would do.
Yeah, I do that sometimes.
the catheters, chest
Oh, look
tubes,
at he's a pro now.
everything has started to click.
Almost like I was going back the bat signal or something. Got to get those bubbles out.
Oh, is that what they're doing?
Yep.
Like how he just like jumped up from his waist.
Oh, looking for like timpani.
Oh yeah, I've seen you do that before.
Yeah. Seeing if there's like dullness where there might be air or fluid underneath, or if it's like tympanic where there's a lot of air. Like, I don't think you saw I was doing it.
Wait, tapping?
Tapping the finger.
Yeah.
Have time to listen to music, then I assume you have time to finish your paperwork.
Where he was so sweet in the first
I
part of
know.
episode 1.
Keep moving.
You think they're gonna keep that intro from
No, Superman.
bit nostalgic, I think.
Oh, for the new one?
Yeah.
I don't know.
How's it going?
I'm 37 years old and I'm a janitor. How do you think it's going?
37, he's younger than us.
I know.
Back to nothing. No, seriously, come on. You can come over to my humble house and point out things that are cheap.
Your dad was a janitor.
Yep. Hardworking man.
Oh, be nice to Rowdy. The guy we bought him from used to keep him in a box full of old hats.
Ew.
Look like he's moving.
I think,
Doing? Why is she here all the time?
Just give her a chance, man.
is it taxidermied?
She forgot to check out the statics on a patient, and then she gave me attitude about it.
What'd you tell on her or something?
Who's responsible for this?
She is.
Oh, yeah, we talked about how you don't want to get on the nurse's bad side.
Nope. And I think she used the term orthostats. So it's checking blood pressure when they're sitting and then checking it again when they're standing
Oh.
to see if it drops. That's called orthostatic.
He's black, too. You should tease him about that.
Hey, Bambi, that blonde stick you hang out with? Tell her que se cuida la narguita esa porque si no le voy a tumbar todo el tinte rubio de la cabeza.
I didn't catch any of that.
I thought you knew a little Spanish.
Yeah, a little, but un poquito.
It's like the...
Of course, it's your attention to detail that impresses me most. How many packs a day, genius?
Half a pack?
Oh, I'm sorry. I phrased the question wrong. How many packs a day, really?
11.
11?
I don't know where I'm coming from. 2 or 3 packs.
I was going to say, I mean,
Well, let's hear it.
Oh, I don't smoke, so 0 packs.
What tests have you ordered?
Oh, I know. I was totally kidding with you. I ordered blood cultures and a high-resolution CT.
What are you looking for?
maybe pulmonary fibrosis.
Cancer.
When you say the word cancer, every person reacts the same way.
Excellent.
Not like that. There it is. How's surgery?
It rocks. But my bedroom, that's where I really operate.
Oh my God, it is you.
Really? That's a little exaggerative.
I know. You said the last episode that you majored in resology, didn't you? Was it the last, or was it on the pit?
No, it was here.
I'm not really interested in her. Yeah? Then maybe the Todd will show that little biscuit some love.
Maybe he's a little interested.
Just a little.
Fine. Todd will show himself some love.
And I never referred to myself in third person.
No. I mean, you weren't that cringe either.
No.
That's him.
That was interesting.
Yeah.
Hi, how are you? I need David Farr's chart.
We all need lots of things.
Yeah, all the nurses don't like her.
Yep.
So, for the chief of medicine, is there a special way to communicate with the nursing staff that I'm not getting?
Oh.
Oh.
Sugar won't work because they're already so sweet.
Look, he knows the game.
Don't try to drag me into your pathetic, whiny little squabble with that god-awful bunch of malcontents. I hope you all kill each other. Have a great day, ladies.
Jeez.
I got Will's CT results back. No cancer. So what should I tell him?
I'd open with that.
When you really lock in with a mentor, you start to understand the meaning behind
That's
their
the
words.
mentor.
You do whatever you want.
Means great idea.
Do you have a mentor?
Oh, several.
I don't want to.
Come on.
Carla,
See how the other nurse folded her arms?
Yeah.
no, you shouldn't have.
Ah, the comfortable silences.
But thank you for apologizing.
Okay, good.
I just want to make one thing clear.
Nothing needs to be clear.
Yeah.
I still think you were in the wrong. Checking orthostatics is your job, and I need to know that you're going to take care of it.
You know, there's a saying that if you want to get out of the hole, first you got to put down the shovel.
Yes.
There. All better.
Now you have no signs of cancer.
Who rules? Will rules.
Well, it's important you realize this isn't great news. Yeah, well, Will, you're on a slippery slope.
Oh, it's because smoking.
Well, yeah.
How would you like to sound like this?
Let me see.
It's a bit unorthodox.
Yeah.
This is so cool.
But gosh.
No, it's not.
Really. Okay, Doc.
It's not a toy.
Would you like to play a game?
You're a great patient. I like you enough to hope I never see you again. But I promise you, if you keep smoking, you'll be back here. I bet my own life on that.
He got through.
He looks very familiar.
Quitting smoking is the hardest thing there is to do. It takes the average successful person to have quit 7 attempts. So it is without a doubt the most difficult thing to quit. But keep trying.
I got him to quit smoking.
Forever? No last one? Because the last ones are better than sex. Trust me, I've had about 1,000 of them.
Done forever. He swore to me. I reached him.
They had a moment.
Yep, there he is.
Just like he had.
And that's what ends up happening
You're
is
having a
they
big
start
day there,
hiding
Susan.
it
Yeah.
from people.
Yeah.
Because they're ashamed.
Private party.
Yeah. I don't know if there was ever an era where you could smoke inside hospitals, but
I bet there was.
I mean, maybe. Well, back in the day, you know, it was always funny. You go to restaurants and it was like, do you want the smoking section or the secondhand smoking section?
I remember when I was in hair school, they could smoke inside buildings, and clients were allowed to smoke under the dryers. And the break room was all smoking too. So I would sit in there surrounded by like 15 people smoking.
Oh.
Anyways, at one point, my director came in there and saw me sitting there with all these people smoking around me, and she screamed at all of them. And then I got the glares and the looks as soon as she left. Like I had told on them. I was like, I didn't say anything.
Yeah.
So she told me I could start eating in a, secluded by myself, which I was fine with. Totally fine with.
Probably preferred, honestly.
I did.
Gotta get right back on the horse.
Oh, I love that they have a pack
Dr.
name.
Cox, about Will.
Not now.
Did you have one at your hospital?
No.
Okay.
I mean, the breasts are probably fake, but by God, those tears are real.
Time for a bold move. I need to know how we're gonna fix this thing with Will.
Do you know what you've just done? You just lost all lapdog privileges.
What's that?
Streets, no more following me around the hospital. What do we do with the lapdogs who can't behave in the house?
Make them stay outside?
That's right. You now have 5 seconds to get out. What do you want to watch there, Captain Courage?
Days of Our Lives?
Attaboy.
And these are the days of our lives.
Yeah, I never watched that.
My grandma did.
Smells of food.
Is it kneeling now?
Hey, move your butt.
No.
Okay.
Anyway, I'd like us to be friends, and I thought, maybe I could get to know you a bit better. See what you're about.
This is going to be like an ongoing joke.
That's my mom.
I like her freckles. Jeez!
Who really knows him? I mean, who does he hang out with here?
No one.
That must be lonely.
Take 2 turfs is needed, applied to sensitive areas.
Oh my gosh.
I had a friend who was kind of like this.
Like Turk?
A little bit.
It wasn't Peter, though.
Oh, no.
But most of all, I'm looking for the real thing. And you're nothing but a little boy who's not used to being told no.
Oh.
Bunch of reasons. Pick your favorite.
Dr. Samotas.
And he only wants her more now.
The hospital is a tricky place. I mean, it's very cliquey, and you have to watch what you say. It's a lot like high school.
Is that's not supposed to be him, is it?
No, that's
Oh,
Elliot.
her. Okay, I see. Yeah.
That's funny because Turk played in Remember the Titans.
Yeah.
And he was wearing a similar colored jersey there.
That's funny.
But you see, tonight, there's somebody else I have to take care of.
It's Will.
Oh, no. I was going to say, I don't think he's going to a patient's house.
We'll talk it out. We'll just break the whole thing down. Right? What do you say to that?
Okay.
Sick of it. Everyone keeps ignoring me. I'm like a damn plague around here.
Please, don't look back at me when you're talking.
Can't be associated.
Can't associate.
I mean, there's definitely a real thing with the nurses.
Oh, it is, yeah.
If it translates into a show like that.
Yeah.
Good gracious, and instead you pass the credit on to a nurse. How noble. I'll tell you what, I'll get the cafeteria staff to write, was it worth it on a big cake for you?
Can I count on you to never drop by here ever again, or should I just go ahead and move?
Leave a place with this much warmth. I especially love the shelf filled with personal photos of you. It's not.
Well, then, would you stay and watch the game with me? Maybe have a slice of pizza?
Is he being serious? I feel like it's a trap.
No, there's no way.
No, I know the couch isn't very deep, but we could move the back cushion.
Oh, is he like trying to come on to him?
Hey, you guys, what do you say? Beer and chips in the back.
Just ignore them. Did you tell me the answer to this question? Do you want to be the big spoon or the little spoon?
Oh, God.
He's not serious, right?
I don't think so. He's trying to make him uncomfortable.
And now I find it so amazing to see how strong you are, how well you carry yourself, how I'd give anything just to wake up in the morning and watch you read the paper.
Look at all the nurses like listening.
But instead, I think you should hop off your broom for a second. Try and remember what it was like when you first started here. Give Elliot a break. Your ass is especially fine today.
Pick me up tomorrow at 7.
Oh, that paid off.
I'm not the only one to do a speech. I can do a speech.
You're gonna what? Rescue me from loneliness with a $3 6-pack of light beer? It turns out we can't save people from themselves, newbie. We just treat them.
Mm-hmm. Oh, look, it was a lesson.
All I'm saying is that if you keep living and dying on whether or not a person changes, well, you're not going to make it as a doctor, that's all.
So this ended up being pretty profound.
I know, I was just thinking that.
It's okay, come here. Come here.
He's a little...
Oh, get out of here. It's embarrassing to have it here.
I'll drink it.
I'll take the beer. You'll beat it.
Man, that was like, it was really profound.
Yeah.
Do it really fast, like a Band-Aid.
Here, I wrote out the pharmacy renewals on all your patients.
I did write that down to talk about later.
Pharmacy renewals?
No, the
Really helpful.
that exchange.
Oh, okay.
I think the one thing we never stop looking for is acceptance.
Thank you, Carla.
You're welcome.
So when's the baby due?
What baby?
Ah.
Oh no.
Because thanks to him, I started to look at all the people who are important to me in terms of what will probably kill them. Heart disease, liver disease, somebody choking her.
Is there anything else, though?
Nope.
But you wanted to.
Yeah, but you told me not
Jeez,
to.
JD, would you be a man? Look, if you can't stick to your convictions, you'll never make it as a doctor.
Okay.
I can't believe your head exploded. If your head explodes, you'll never make it as a doctor.
That
I
is
mean,
true.
come on, you look ridiculous.
It was completely conflicting advice.
Well, but it's okay, but it's brilliant advice when you think about
Yeah.
when you think about the constant, I guess, tug of war,
Mhm.
yeah, that exists between that sticking to your convictions, but recognizing maybe when to pull back. I think, see, this is one of the things I love about primary care, because obviously internal medicine, like, you know, as an internist, you can work on the inpatient side, taking care of patients, which is what Dr. Cox and JD are doing, or you can be on the outpatient side, taking care of patients as a primary care doctor, which is what I do now. And I think one of the really cool things about that is as you do become close with your patients, it's no longer like, I mean, it might sound cliche, but there is that family element to it. Like there's an ownership to it. I know I've said this before on other platforms, but part of why I like being a primary care doctor is you're not the doctor, right? When a patient is telling their family about like what happened when they went to the doctor, and they're saying, well, what'd the doctor say? What'd the doctor say? When patients are talking about their primary care doctor, they're not saying, oh, the doctor said this or the doctor said that. They're saying, my doctor said this. And that's important to me, that ownership, that's a distinction. So I think when you get to know folks, you maybe mold your approach based on that relationship you have with them. Like there are patients who, no, I'm not going to go in and start trying to give a science lesson on the harmful effects of smoking or something. We might briefly bring it up, but we might briefly move on. And then there are patients where maybe I do have that moment where it's like, all right, we need to really talk about, and this doesn't have to be smoking, it could be anything, but we really need to have this talk. And it's coming from a place of love. Like it's coming from a place of, you know, it's not just medicine sometimes. So I think that was kind of the point of that. It was obviously a pretty profound moment there to say, look, if you live and die by your ability to make somebody change, this is just true of life. Like you're going to end up very, very sad, broken, and feel unaccomplished.
If someone was a smoker watching this, not that you're giving medical advice, what's like something really important as a primary care physician that you would recommend anybody who's a smoker to do?
Well,
like testing or
that's a good question. So, well, I thought what you were getting at is like if I had to like give a plea or something, it'd be like depending.
You can do that
Well, depending on the relationship I had with the patient, I would look at him and I would say, "Listen, my dad died of lung cancer because he smoked for 40 years. I don't want to see you go through what he went through, what our family went through, right? Because in that case, you know, and I've said this in other platforms, cancer doesn't just steal lives; it takes time. It takes time away from the person who it took from us. It takes time away from the family that's left behind. It's not just the empty seat at the dinner table kind of thing. So that would be my plea, right? Now, as far as what you can do, there is screenings for lung cancer, and we are able to detect these things much quicker than we ever have been. And I think when I looked last time, like the screening rates of, we'll say eligible candidates, that those who are actually pursuing screenings, it was like really low. Like for lung cancer screening is one of the lowest rates that we have. So we need to get that better. But you can do a CAT scan. It's actually not a high resolution CT scan, which is what JD did here.
Oh, okay.
It's what we call low dose CT scan. But you can do this every year, and you can do it every year if you're eligible up until it's been 15 years since you last smoked. So once it's been 15 years, then the risk goes back to that of the general public.
Oh, that's interesting.
So during that 15-year period, you can do this. So this is something we talk about on a regular basis with my patients who are eligible. And so I know that, I mean, I don't know that
It doesn't really if you want to talk about this or not, but like it didn't nothing showed up in your dad's blood work
no,
that indicated.
no.
And he was hiding things.
Yeah, well, look, in this, and I don't know that we intended this to go down
I know,
like
it just happened.
This pathway of smoking and all that. But one of the common misconceptions that I hear is if I say, "Hey, any thoughts on doing this screening test?" And it could be any screening test. It could be for breast cancer, colon cancer, cervical cancer. It could be blood work for diabetes. One of the common misconceptions, though, is sometimes I'll get patients who say, "Nah, I don't think so, doc. I feel fine." Well, so just because you feel fine, obviously doesn't mean something's not lurking. Or the other thing I'll hear sometimes is, "Hey, doc, I don't think I need to worry about that. I don't have a family history." And while family history does increase your risk, 75%, roughly 75-80% of all cancers diagnosed today will be in folks without a family history of that cancer. So anyway, I didn't intend this to turn into like a preaching moment, but I hope maybe somebody takes something away from that, because that's obviously my passion. That's what I do. JD's passionate about it. Like he's, and I feel that because we share that passion.
I will say, if you smoke with that family history, though.
Yeah, if I smoked, or,
I'm saying, well, because your grandpa also died of lung cancer.
Yes, and my uncle. So
my uncle, my dad, my grandpa.
Yeah.
All died of lung cancer.
Yeah, and
they were all smokers as well.
Yeah, and then now the new era is not necessarily cigarettes. Now we're moving into vapes and Juuls and stuff. There's all
we
the
don't
other.
really know how that's right.
We don't know as much yet, but that's a different topic.
Yeah.
So I think that's good. Look, I love talking about this stuff, but I don't want to bore you guys anymore.
Yeah, we just watched comedy.
I know. We want to keep it a little bit light, but I hope maybe somebody took something from that. And then really the only other thing I wrote down in my notes to talk about was, well, actually it was kind of a continuation of that, was Cox and Dr. Cox, when he said you can't change people. And then later he said, well, and then later he said you have to stick to your convictions.
Yes.
So again, I actually love that balance, that counterbalance. And sometimes we need others to find that, like to help us find that. And so actually I think Dr. Cox is actually a great mentor, despite the fact that he is the king of sarcasm, clearly. But I kind of like that.
Did you have a mentor?
Yeah. So I've had many mentors over the years. It's hard to maybe pin down on one.
I can't think of one that like mentored you, like to where, I don't know, some of your convictions or just something. What comes to your mind first?
It's really hard. I mean, I guess Dr. F.
Dr. F.
My program director when I was internal medicine.
Oh yeah.
Yeah, I mean, probably him. I think just taking away that, like, his duty of care.
He doesn't like Dr. Cox though.
No, he was a little bit like, well, that's me. What's the older gentleman?
But he wasn't evil.
No, he wasn't.
Well,
I mean, he was stern. He was never like that, though. That guy's a unique bird.
That's just because you were a gunner.
I was not a gunner. Okay. We got onto this topic for those of you who don't know what a gunner is a overly ambitious, usually kind of success mode, like motivated by being the best of the best. And this is usually referring to a medical student, maybe a resident, one that tends to be obnoxious and nobody else quite likes. But no, I was absolutely not that. You want to, your job is to fit in, make people happy, and not bring unnecessary attention to yourself.
Yeah. I don't see as many people smoking as I used to, but.
No, you don't. Not regular cigarettes, at least. So we're evolving. Yeah, which we might talk about later. All right. Well, thanks for checking this out with us. Another great episode. Can't wait to jump down to episode 3. I guess I'm a little worried about episode 4.
Apparently
you told that some tissues and
some comfort food.
Okay. Well, I wasn't expecting for this to be sad.
I know.
But that got a little sad there. Anyway.
Yeah.
All right. Thanks for coming back, guys. If you're new with us, please consider giving us that subscribe. See you next time.
See ya.
So I says to the guy, wrecked him. Damn near killed him.
What?
You don't know what movie that's from?
No, what is that?
It's from Black Sheep. Chris Farley.
Oh, yeah. One of your faves. Tommy Boy.
Mm-hmm.
I only know that guy in a little. I was just laughing because there was one time I gave you what was it? You trying to put on that coat?
Wow. Man, why don't you just air it all out?
You remember what that was? What was that?
I don't remember. I tend to try to suppress memories that
When I
crush my
started
spirit.
singing that song.
Yeah. I assume you're going to cut all that. I am Dr. Todd.